Good morning, everyone. I would like to welcome you to our Northside Urban Coalition meeting for October 21st. My name is Diana Hawkins. I'm the Executive Director of the Hawthorne Neighborhood Council and the Coalition. As always, we're pleased to have our moderator, Mr. Al McFarlane, with us today. And with that being said, I'm going to turn it over to you, Al.
Good morning. Thank you. Thank you, Diana. Good morning, everybody. Beautiful with Friday morning. And thank you all for being here. Thank you for the service to community, for our friendship, our cooperation that we all bring to community every day. As always, a great program. Special thanks to Diana and the team at Northside, at Hawthorne Neighborhood Council, and all of you as partners in the Northside Urban Coalition. I want to begin by asking one of our partners, Clarence Jones, at the Human Partnership, to provide an update. Good morning, Brother Clarence. How you doing, man?
Good morning. Can you hear me?
Yes.
All right. Thank you. Thank you, Al. As you know, more than 2 years ago, Human Partnership came alongside of the Hawthorne neighborhood, and we joined together and the Urban Coalition to work together on a project around finding data and narratives about how the community was being impacted in North Minneapolis around COVID-19 and opioids. We had a very successful survey, which many of you are really aware of, but I wanted to let you know how this partnership has expanded. This partnership is now being replicated in about 5 communities around the city. We just had someone from New Zealand come in to talk with us about how we work in community. And so today, the 2 speakers that are here are also part of this partnership. David, who is an IT person, will explain more to you what that means. And Ms. Sarah, who is out in Shakopee. I mean, so the work that began in the North Side is expanding in ways that you do not even that I can't even understand. But people are really trying to look at this work around how do we develop, how do we learn about the strengths of a community. And so the next step for us is that we are doing the My Strength, My Health in the Somali community, which Sarah will talk about. We also are going to be doing it in Spanish. And so I want you to know that this is a model that other people are trying to, other people are replicating and want to be involved in. And so I just want to thank you all for the support that you've done over with the coalition and with Hawthorne. The other thing that's happening in terms of an update is that we are also doing a project around strokes in the African American community. We're actually looking at about 6 to 8 focus groups asking African Americans what do they know about strokes and how does it impact them and what are the next steps for us as a community to be informed about strokes. The other part that we're doing is around diabetes. We're doing things around finding out about utilizing an app around diabetes. I mean, so there are a variety of different things, but many of those things come through Hawthorne and Northside. We made sure that we were inclusive and make sure that this is a community-based participatory, and any kind of research that we've done will be community vetted. So I just want to thank you. I'm sure I've got like 8 other things I can tell you about. I can't remember because I'm driving, but I just want you to know that I so much value our partnership, and Ms. Diana, you probably can tell people more about what I forgot. But anyway, thank you very much. So that's my update. Is that we're doing a lot of things. Oh, one other thing I want to share with you is that we did have a partnership with the city of Minneapolis around Narcan distribution and education. So we are in the community contributing to helping to erase or to minimize this issue around overdoses and in our community. So that's what I want to share with you. Thank you.
Great, great. Thank you, brother. So let's continue with the agenda. I'm glad to hear this report. Wanted to, I'll get back with you online, compliment you on doing the work that's going to be in Spanish. I'm working with the Council on Minnesotans of African Heritage, and what we're doing is trying to create a space for acknowledging the presence of Afro-Latinos. It's a population that's kind of invisible, but it's here. And so the project we're doing is called Afrodescendientes. And I bring to that my own Cuban background as an Afro-Cuban. So that's important to hear that you're doing this work in the health field as well. Look forward to collaborating with you on that. Why don't we go on through the agenda then? And Diana, we have here, it says main topic, introduction of a new application and opioid crisis. And our presenters are David Haynes II and Sarah Odoa. David Haynes II is an assistant professor with the Institute for Health Informatics at the University of Minnesota. He is a trained health geographer who works in health disparities and digital health tools. He's creating a mobile app that connects people with social care needs to community-based organizations who can respond to those needs. And Sarah Odoa is executive director of Advocates or Advocacy, maybe, I'm not sure if it's right here, for of Advocates for Thriving Communities. And it's a Shakopee-based organization, right? She's a mental health practitioner, a member of the Scott County Mental Health Local Advisory Council, and she's going to share information about substance abuse in the Somali population. So thank you both for being here. Let me begin with turning the mic over to David Haynes II.
Hello, thanks. Can you guys hear me? Thanks, Al, for the introduction. So today I'm just going to talk kind of briefly about some of the work that I've been doing and how it might be of interest to this group. And I've been working with Clarence for about 1.5 years of it on some of these tools that we've been developing and trying to show you some of the work that we're doing. My work, like it was said, is I'm a health geographer, and I do a lot of work on health disparities and cancer disparities. So I have a program right now that works with African-American women and immigrant African women on getting them access to breast cancer screening. And kind of a lot of the work that I do kind of focuses on taking a lot of data, creating data, but also bringing it towards the community. And so this is the project that Clarence and I have been working on, which kind of dovetails with a lot of the work that he's been doing with the My Strengths, My Health group. So I will go through a little bit of slides, and then I want to show you some of the pilot and stuff that we're working on. So the project that I'm working on is called Smart Community Health. And this is an app, and we're piloting this with North Point Health and Wellness this next week for 3 months. And I'm interested in generally getting community organizations to participate in this pilot to see how people can get access to resources. So I'll just kind of briefly go through this and show you some of the technology pieces that we're doing. So the way that I think about this as a geographer, people end up being in particular locations or spaces where they do or do not have access to certain resources. And this is just a huge issue with like getting people access to care. That's really what I study. How do you get people access to care? How do you improve access to care? How do you do that effectively? And so when you're looking at social needs like housing, food insecurity, income, healthcare broadly, financial related stress, right? How do you get people access to that information when they don't know where to go to find that? So there's a disconnect, right, between the organizations and where they're working and the people, and how do you kind of streamline that? How do you make sure that it's easy for people to get access to the information they need in a timely, like in the moment of need sort of situation? And so we kind of went ahead and developed a mobile app to kind of help support this. And we're thinking about how this can be, I'm in the medical school, so we talk a lot about population health, but this is really like, how do you empower the community? So we developed this app. You can download it. The patients that we'll be working with at North Point will be downloading this. That uses a social determinant screening tool, the My Strengths, My Health, to help people identify their needs. So I've talked and worked with Karen and Robin before. And what we do is a little bit different in terms of you go through parts of the screening tool, but when you screen, we refer you to the resources in the community that are there at that moment. So we're trying to make sure that people don't just identify their needs, but actually help them get access to those organizations. And then I'm also going to show you this community dashboard where the organizations register themselves. And that allows them to engage with the patients and help them get access to the resources more quickly. So we think that this is unique because this is more point of need. So whenever people have a particular need that they want at that moment, they can get on their phone. Many people know about 211, and I'll just kind of give you an example of why this is a little bit different. In 211, right, you have to register. You've got to be an organization that's going to be open like 300 days a year. You've got to have, employees and things like that. So, especially what I think when you think about like throughout earlier in the pandemic, right, a lot of churches, small organizations were doing anything they could to help people out, right? What they're doing, food drives or like they were doing anything. That doesn't go into 211. And unless you're connected to that community, you can't find out about that. So there's a lot of work done by these other organizations like 211 to maintain the accuracy of this data, which is really important. But I think that you can do a fine job of allowing the community to kind of say what's there much more effectively. So that's what's really the point of this. Just like the community is always developing it, always monitoring it, always changing it. And that allows people to really not just put their stuff up like these are the services or programs that are available, but kind of advocate and say like, hey, if you're a church and you're going to start you're going to do a cookout, do you do it on Thursday or do you do it on Friday? Right? It's dependent upon the people, but it's also dependent on like, well, is another group doing this on Thursday? So if they're doing it on Thursday, let's do it on Friday. That way people have multiple meals that they can get, right? And this is what I'm trying to do, is try to make a more community focused tool that lets people do this. So this uses the My Strengths, My Health system, where you can go ahead and look at these domains, but I'll just kind of show you the application and then I'll jump into a couple of different live demo things. So this is essentially the idea of the app. You go through and you say, you download it, you find a particular area that you want in the My Strengths, My Health. You say that you have some potential questions, and then it gives you organizations that you connect with. And we're trying to go beyond with the community organizations that we're working with now, beyond the general inbox, right? We want you to be able to say, like, if I'm going to go to, who's the person at North Point, like, who's doing the walk, who's at walk-in counseling that I can connect with. Essentially like a counselor that you can start a conversation with about when can I get a time to come talk with you, right? So we want to make this more point of contact. You don't have to go through an inbox. They can kind of do those sorts of things themselves on their side, but make this more direct so people understand who they're working with, not just the general inbox. Okay, so let me kind of give you a slightly, hopefully this doesn't break anything. Understanding. So I think you should be able to see my screen in a second. There we go. Okay, so let me make sure that this is sharing the right stuff. Okay. So you should be able to see the mobile app on one side of the screen. And this is the My Strengths, My Health survey tool that many of you guys have talked about previously. Essentially, you go into one of these areas. The questions are all the same that Karen and Robin have done. So they're written at a really easy level. And then you check the needs that you have. You don't need to go through the entire survey at once. You just do it as you want, based upon the needs that you're looking for. And when you click it, it'll give you a collection of organizations that are providing those services. So you don't have to think about this as a survey in terms of like, I need to complete this. This is like, as you have needs in your life, you go through it and identify what you're looking for. So if you have any particular need, you go about and find those. So, if you're looking like, okay, I need help understanding with caretaking, you would go through that and you could find those needs. So there's also, how does like all those organizations get populated? Well, we're recruiting organizations from the North Point and North Minneapolis area that working with North Point Inc. or new or small or whatever to participate. And so the organizations themselves, they create their own services. So here you get to choose, what is your organization doing? And this is by like at the individual. So if you are doing mental health services and you are respond to people that have mental health needs, then you would click this button. You get to choose the ones that you're working with. And because the organization has the ability to log in, they're able to change and update these things all the time. And it's real time. So whenever your organization, is talking with the Urban League and they get a new program, you can put this in the app. And then people have understanding and get access to that new program, right? It's a lot easier than finding this. So that's kind of the idea, is to keep this always real-time updated whenever programs are available, have that capability. So right now, so we have two apps here. We have the mobile app. We're recruiting 30 people from North Point Health and Wellness, their healthcare homes teams, and we're recruiting about 20 community organizations. We've already got about 10 or so. So we're looking for about 10 more that are interested in participating. And I can kind of really quickly at the very end here go over the last little bits of that. But we're looking for organizations that would be interested in participating in this and would help these potentially 30 people from North Point through this. Longer term goals, we already have money to rebuild this. We've been talking with people at West Broadway and other groups that are interested in seeing this application exist long term. So this is a good opportunity for people that are in this space to think about a community tool. And in this pilot, really provide lots of feedback to us about, this doesn't work. This is what it needs to look like. This is how my organization would use this. so we can really get a better understanding of how to develop this tool appropriately. All right, let me just clear up real quickly a couple of different things. So we have a web page, and I guess I'll put this in the chat, the smartcommunityhealth.org, and I can give you my email if you're interested in participating, or if you know a community organization that you think I should reach out to, please let me know. The organization will be able to create your own service, and I'll go through what the pilot looks like with North Point. Basically here, one of the things that we're hoping to do in this 3-month pilot is get a lot of, obviously, data about this, but we also want to start sharing this out with the organizations. Many of the organizations, right, you give these services, and when you're applying for grants, you've got to tell how many people use this and received goods. We want to provide that stuff kind of real time in the dashboard so that people can only understand for their organization how this is working. It's not going to be available in this first version, but in the upcoming version, this is what's going to be there. All right, so I'll just kind of finish this up here in a couple of minutes, the North Point pilot. So what we're really doing is interviewing a lot of different organizations about how do social care referrals work. And we want to get everyone's perspective. Mostly this has been driven right now by the healthcare system, but realistically, my opinion is that this really lives with the patients or the individuals who are receiving these goods and the organizations that are providing them. And until we really focus on designing how that works for those two groups, the referral process is kind of, and it's at a hard point. So we really need to understand how this works. And this becomes a really big issue because if you are a community organization who is providing services, say for instance, for housing for these patients, you may save a healthcare system, like $1 million. But that $1 million doesn't really come back out to community organizations because you're doing all this work to keep them, from getting, falling back into the healthcare system, which is good, but that saves them money and that doesn't come out to the community. So we really want to be able to form this sort of, in order to make that argument, you've got to be able to have the data to convince them and say, look, this is how it's being tracked. This is how it works. So that's kind of really a good crux of this project works around. So we're recruiting 25 patients, 25 to 30 patients from North Point, from the healthcare homes teams. So they're already going to give us the people or help us find the individuals who will be doing this. We have some funds available for some of the patients if they don't have phones, that we can provide them phones to participate. So we're going to have 30 different people, and then we're looking for about 30 to 35 community organizations to participate based upon availability. Let me just kind of skip to this. So each of the groups gets funding, and we have funding for them. So if they're a patient from North Point, they can get up to $125 for agreeing for the study. And then every month we send them a survey. Every time they complete the survey, they get another $25. And when they do an exit interview, they get $25. And then the same is true for the community organizations. And they receive up to $250 per member of the organization. And so that's just basically, you have to consent. We ask you to check our webpage where you're going to have the ability to chat directly to the person's phone about the needs that they've kind of connected with you about. And we just ask that you would do what you would do normally. Very, very aware that a lot of community organizations are extremely stretched from the last 18 months. And, we just really try to do what you would do normally. We're not asking you to take a lot of this on. The nice thing about this technology is it captures all the data for you. There's nothing that you need to like log and report for us that is different from the apps. So you do all the work in the apps and we collect all that data and we use that. And so we really want to try to make this as simple as we can for community organizations to participate and help that this works out for both groups.
That shouldn't say Patients 250, should it?
Oh, no, I'm sorry. That should say organization.
Right, okay.
And that's really all I have. So I've got my email here. I'll throw this stuff in the chat. But I'm really happy if people have questions about this to answer any other questions.
Any questions? Again, great presentation. I'm excited about this. Any questions or comments, anybody? I have some, but I'll let other people go first. Impressions, thoughts, comments, questions. First question, I know you've thought about this. How do you differentiate this from another popular neighborhood type organization called Next Door? I think people are joining that, and that's different in intent. This is more specific, more intentional. So talk about the difference in these two.
Yeah, so I think the idea is that we're trying to have a broader sharing capability where so one, you have the app where everyone has access to the information all the time, real time about what's going on there, so that it's on the phone where a lot of people are more used to are kind of gravitating towards. And then, I think the other thing is that we're allowing the community organizations, I think in Nextdoor, you guys can kind of control that, but we're kind of making those direct connections a little bit easier so that I'm not having to figure out something. So an example is like when my grandfather was going to, we were going to put him in a home. There was like, they gave us a sheet of like 20 organizations, right, that you could go. And that was like, well, what about his needs? Like, how do you filter this? Like, how do you make this easier for me to understand who I should go talk to? And so I think that's the thing that I believe with this sort of system we want to be able to do is make this easier for people to say, like, I am looking for this. So, I have kids. If I needed to go to a food shelf, do I need to, like, I need food not just for me, but I need food for my kids. Where can I get that? Who has those sorts of things? Do I have dietary needs? Some organizations provide those, or do I just need food right now? Who's open right now that I can get food from right, at this moment?
Okay, great. I'd love to figure out, I'll call you offline, how as a neighborhood business, Insight News can be a part of the resource group. I don't know if you focus on just care providing or resource providing organizations, or is there a role for a business as well, particularly a communications business like Insight News? But I can call you back on that separately.
Okay.
Any other questions or comments? Let's move on to Sarah. Is it Odawa or Odawa?
Odawa.
Odawa. Good morning. Let's see, I think it's Subak Wanathan.
Yes, you got that correct.
Okay, great.
Thank you, Al and Diana, and thank you, David, for the wonderful presentation. My name is Sarah Odawa. I am the Executive Director for Advocates for Thriving Communities, which is a community health-based organization or nonprofit. We're based in Shakopee, Minnesota, which is southwest metro from the Twin Cities, where I reside. We also have a location in downtown Minneapolis. And so we are a fairly new organization. We work with the communities alongside with local organizations throughout Scott County. I am a mental health practitioner as well as a public health practitioner. So my work has been working with various communities, in particular the immigrants or minority communities throughout Scott County. I have really worked to ensure that our communities are very well educated on health disparities, where we've seen throughout COVID-19 last year how detrimentally our communities have been impacted by COVID-19 with access to healthcare, as well as just making sure that our families are well resourced and have the tools to live thriving lives. We are an organization comprised of health professionals, educators, community residents, just really working towards ensuring that our communities are well adverse to health education. A lot of our problems or the issues that we currently see in the Somali community in particular is lack of our access to health care. A lot of the issues stem from not really knowing where to access resources in terms of applying for health insurance. We work with a lot of people to ensure that they have insurance to be able to see a doctor. We coordinate and collaborate with other community organizations that really ensure that they have adequate housing, affordable housing, also ensuring that they have food for their kids on the table. A lot of the issues that we're seeing right now with mental health is that we are seeing a growing opioid substance use amongst our adolescent or younger Somali population. Our kids who had either were born in this country or were raised and came at a young age. We are working with Clarence right now to address the opioid use as well as COVID-19 through utilizing the My Strengths, My Health app, which I'm very excited about. We will hold the event on October 30th, which is next Saturday, where we'll be asking participants to use certainly electronic to ensure that they know going into the event what the purpose for collecting data is all about. The end result will possibly be to utilize the data to bring into our communities so that we can utilize the data to provide services, focusing on health and wellness. And also educating our communities on various topics such as healthy eating, physical activity, mental health, oral health. So we want to be able to utilize this data to ensure that we have the services in place for our communities, but also to educate our parents on opioid use, substance use, which is a growing concern in our community. We're seeing a growing number of kids using, and parents are not aware of their kids using or just the topic of opioids in a general sense. There is a lot of factors with kids using due to peer pressure. A lot of the kids are accessing these drugs under a black market, you could say. A lot of the parents are not really knowledgeable about opioid use. So a lot of the growing concern is that there is a disconnect between, kids or individuals and parents, and a lot of the issues that we're seeing is that the parents are not, not willing to have these discussions. I'm not saying all parents, but in the work that we've done, a lot of the, the individuals that we've worked with have not disclosed information to their parents. So they're looking into working with a mental health practitioner or someone that they can trust, that they can talk to, because they are not, receiving the supports. Another issue is that we don't have a lot of services that are culturally appropriate or specific to meet the needs of our individuals that are seeking these services. And so we need to be able to establish programs in the community. I know that there are a few right now that are working with the Somali youth to educate the individuals about substance use, opioids, and the side effects as well as the health adverse effects when using. We want to also be able to educate our parents and the elders in the community that this is a growing concern and that we need to be able to interact with our individuals or our kids that are using, to not bring shame, but to also understand, that this is a problem and how can we work together to resolve this, this taper the issue, and also talk to our kids and have these discussions about how we can work with our kids, establishing a rapport, but also providing services that are culturally appropriate. Because a lot of the parents, they want to be able to interact and involve with their children or their kids that may use, but also involving them throughout the recovery process. So a lot of the work that we've done in the community has been educating our communities on, mental health issues, as well as the substance use, and, ensuring that they have the resources in place, but also services that they can go to that they feel comfortable talking to providers, to ensuring that they have the services in place that they can be able to, receive the treatment. A lot of the needs are pretty, common throughout all communities, and especially immigrant communities. We don't have a lot of services that are culturally specific. And so a lot of the individuals that I speak to, that I work with, they want to be able to have these conversations with a provider that they can, understand, that they can, come from a similar cultural background. And so a lot of the services that we refer clients to are mainly in Minneapolis, which is quite a long drive from Shakopee to Minneapolis. But, it's worthwhile when I hear success stories and, see that there is improvement, but also to ensure and to educate our parents as well, because that is, another concern for us as well, because a lot of the parents are not aware. They have, lack of knowledge of opioids. So the first step where we are working with our local mental health practitioners who are of Somali background, to ensure that they are well educated, to ensure that the kids or the individuals seeking the services have the parents involved as well. So I think where we have that triangular relationship, where we have the provider, the individual seeking the services, and the parents involved, I think it really will do, much work, be much of help to ensure that the individuals seeking the services have the supports in place. Another piece of work that we are currently working on, aside from the My Strengths, My Health survey, which will take place next Saturday, is also we have funds that we provide resources to our families who are in need of, food, clothing items, resources, so that they can obviously have in hand during winter as winter approaches, but also to ensure that, they have the tools necessary to live healthy lifestyles. So we are working with closely the Department of Public Health in Scott County to hold events in the community, to hold trainings. We're working with other health professionals to ensure that families have nutrition, meal plans. We've done work with the Somali women living in Shakopee, where we held an 8-week exercise and health event where women throughout, of all ages would come in to exercise and to also meet with a dietitian, which was very successful. And as a result, were able to continue to exercise, to eat healthy, to work with a nutritionist. And so we've had projects in the past where we've been in the community to address health and wellness, but also to educate. And I know I've been repeating that word a lot because that's very important. And just not with translating, materials in Somali, but also ensuring that they are well aware of, their ability to thrive, but also to be able to have access to these services is very important. And so a lot of the work that we've been doing has been really focused around public health and education. We refer clients if they have any questions about housing, about immigration, but more so to speak, we are really working towards ensuring that empowering our communities, one, and also ensuring that they have the tools to thrive. So thank you.
Thank you, Sarah. Great presentation. Excellent. Are you native born or Somali born?
I am a first generation native born. I was born in the States. My parents immigrated to the United States in the early 80s. So I am number 4 of 8 children. So I come from a big family, but originally from the East Coast. I was born in New York City, raised in Atlanta, moved to Maine, and then Minnesota is home now. So excited.
So what's your general sense of the ability of the community to acclimate and to grow into its own, sense of community, and to also be part of the larger African diaspora community? What's your take on that?
So I could speak to, so in terms of Shakopee, geographically, we are seeing a large number of Somali people moving in from the Twin Cities and also the smaller towns. So say St. Cloud, Wilmer, Faribault. So I would say the Somali community in Shakopee in particular are fairly newcomers. They've immigrated to the United States, 5 years or less. So I would say it's a learning experience on my end. For experience, my personal experience, I've lived in the United States my whole life, but also I have another culture, a culture that I can identify with, the Somali culture. So both cultures combined sometimes could be in conflict. I see that, okay, well, I'm an American, but also I can identify as a Somali. So working with my community in particular is a learning experience for me, but also, I'm here to represent and to be from the community to bridge, the Somali community into the mainstream society, but also our African-American brothers and sisters, where we, obviously we share a cultural background, but also we are able to understand that there are similarities in access to healthcare, in the educational sector. So we can identify a lot of the issues that we're seeing with our African-American brothers and sisters. So it takes you know, a lot of work, I could say, but also it is a learning experience from my personal experience, you know, living in this country, but also, you know, working with my community to, you know, learn from one another, but also to bring that experiences and to ensure that, you know, we're all here to work together. We are not isolating ourselves from, you know, mainstream society. We are here as Americans. We are here. We have a community, but we also need to work together to be able to succeed. So I really talk a lot about, you know, working together, creating partnerships in the community, but also to educate, you know, ourselves on, you know, the issues that we are currently seeing and we're facing. So it is sometimes it could be a challenge, but I really think for the most part it is a wonderful experience working in the community, but also, you know, seeing the similarities and the commonalities with, you know, our African American brothers and sisters, but also, you know, we're facing the same struggles. So it's empowering.
Thank you. Any other questions or comments?
Al, this is Clarence.
Go ahead.
Yeah, one of the reasons why we were so excited about working with Sarah was the fact that when we did our last survey, we found out that the Somalian community was suffering with this issue somewhat quietly, and there was a lot of things that were going on that was not that there was a lot of conversation, and so we purposely utilized my strength, my health, and our relationship with Hawthorne and Northside to seek out people from that community to say, can we talk about this? Because we know that you're part of our community as well. And so I was really happy to say that Sarah took up our request, and we hope with this work that we're doing to really make a difference. I mean, that's really what it's all about. It's not about one over the other. It's about how do we work together in order to make it better for our children. So I just want to say that because that's really what drives this work. But again, it's community driven, and I'm really excited about that.
Wonderful. Thank you. Thank you, Clarence.
I wanted to say, Al, I think Joan had her hand raised at one.
Okay.
No, I didn't raise my hand, Diana, but thank you for calling on me. Diana invited me in. I've been working with Hennepin County and the around the Blue Line LRT project, and I'm also on a new engagement services team at Hennepin County led by Kelsey Dawson Walton. So we're always very interested in connecting Hennepin County resources and programs and services to community-based efforts. It's great to hear that you're very well connected to North Point, because we really view North Point as a treasure for the community. Thanks for calling on me, Diana.
Any other comments, questions? Okay, well, this is a time for a general open Q&A session too. So even if it's not on the topic, if you have a concern or an announcement or a question that you can share or an observation, this is a great time to do it and a great audience to do it with as well. Anybody?
I'm gonna go first because there is an, out here, Clarence, it's a overdose and opiate session going to happen tomorrow on Facebook. Am I right about that, Clarence?
That's correct. That's correct.
Okay, and what time?
So it's going to be from 3 to 5, and it's called the Chop It Up Show. And two of our guests will be Pearl Evans and Sam Simmons. But this is once again, this is where the Hawthorne neighborhood has, because of a leadership grant, we've been able to work with Can Do and other people to talk about this issue. And so it will be, as you just said, 3 to 5 on Facebook. And we're going to be talking about it. We call it a politically non-correct show, where we're going to be able to talk about things in a very serious manner, but we're going to be able to utilize and bring in members of the community to talk about their struggles, their issues, their opportunities, but also where are the resources around that we can address this issue. So this is in South Minneapolis.
And if anybody else has announcement they want to make, please feel free. I'm going to let you guys know that November the 20th, Hawthorne will be giving away coats and backpacks. So please email me. 4 per family. Please email dhawkins@hncmpls.org. We that folks are struggling this year, so we do have coats to give away. Tara, I know you have a event coming up next week, correct?
Yes. So we have the My Strength, My Health app, or My Strength, My Health event that will take place on October 30th. And we are going to have students from the University of Minnesota Nursing Health Informatics Department come out. Clarence as well will be there, as well as participants from the community. We've done outreach thus far. We will be having about 75 to 100 participants coming out to take the survey. The surveys will be done electronically, and there will be gift cards provided to the participants. But we will be holding that event on the 30th, which I'm very excited about. And then also next week, we will be holding a personal care package and blanket drive as well at our Minneapolis location. And that will be next Wednesday. And we're very excited about that. So we have those 2 events, upcoming events next week. And then we'll be holding our open house on November 6th. And I will be providing information to the group if anyone is interested to come out and support us. Thank you.
Thank you. I'm gonna have Mr. Ken. He's from Sam Men. That's another coalition around marijuana. That's a little bit going into legislative. He would introduce himself because that's part of this coalition as well, where we're working on the marijuana issues. Ken?
Well, Diana, thanks for giving me a little moment here. So Smart Approaches to Marijuana Minnesota is a community-based, non-funded, unfunded coalition. We are the state branch of what's the national group called Smart Approaches to Marijuana. So you can find out more about us at sammn.org. We've been around for about 3 years, and Diana has been with us for a bit of that time. We meet once a month, the second Thursday in the afternoons. If you send me an email, I'll make sure you can, and I'll put my email in the chat box. Or you will notice early on, I put it in at the front of today's event. We'll put you on the mailing list and you can get notice about our virtual meetings. And even if you can't come to the meetings, you can find out about some of the things we're doing as we send around information and inform our group about what we're up to. We do not support the commercialization of marijuana, but we are supportive of examining and sharpening or perhaps improving the decriminalization laws in our state and improving the Minnesota medical marijuana program. We're both a group that advances information and research, and we try to help out with lobbying and informing the legislators of our state, since they have a lot to say about whether we go forward or not with legal commercial sales to adults.
Great. Any questions or comments? Thank you for that, Ken. Okay, we got a few minutes left. We want to close at 12. We got about 3 or 4 minutes. Any other comments, questions, announcements? Megan, you're raising your hand or adjusting your camera.
See, David put something in the chat. You want to talk a little bit about that, David?
David, go ahead.
If you know anyone that is looking to do or needs to get a breast cancer exam at Tubman, I'm sorry, I don't know what the clinic, the Tubman shelter is going to be having a free breast cancer screening tomorrow from 12 to 3. So you can walk in and get free screening for breast cancer. The mammogram truck will be there. it's completely free to get screened. So
I can say that we're looking, it's not confirmed yet, to organize a online Fifth Ward candidates discussion tomorrow at 11 o'clock, 11 to 12:30, but it's not confirmed yet, so I'm working on it as we speak. And if we bring it all together, we'll reach out to all of you via email to invite you to be a part of that. We're also aware of an event coming up on the 30th for Fifth Ward candidates, and we'll communicate that to you as well.
As always, my brother, it's been wonderful, and I'm going to give you the last word. I just want to thank everybody. We had some great presentations, and I'm going to give you the last word, Mr. Al.
Well, I'll make it brief. This is, as always, a wonderful and rich sharing, learning, growing opportunity. I thank each and every one of you for being a part of this meeting, but for the work that you do in community. With that, we'll see you next